Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Param Brahma, Tasmai Shri Gurave Namaha. Friends, as we grow in age after 50 or 40, our bone system gets compressed. Slowly our height decreases. What happens in 4 points? It gives impact. First point is this point, because this point just back of this point, the alignment of this point becomes like this. Slowly it becomes like this. Thereafter, a slightly below point, this point, this point. So this point also slowly like this, it becomes like this. So it results in compression of our bone system, rib cage and the backbone system. The third point is back, this point. This area. Okay. So this area also gives rise to compression of bones. And last point is this area, thigh joints. Okay. So for this, when we are doing yoga, yoga has to be verified and analyzed from all angles, because not only diabetics, blood pressure, bone density, thyroid, cancer, okay, constipation. So These things we have to see, but compression of our um, bone system, skeleton system has to be seen also, because slowly you get you don't know exactly. It happens without your knowledge in your body. So regular flexibility, regular exercises on this point can help you stay uh, strong, young, and have a good stamina for this. Okay, now this can be done by two things. First, mind. You know, the strength of mind and the planning of mind is very important in our health. So, keeping your mind in these points, always analyze the condition of these points. You see, every time I am bending forward. In my office, when I am sitting in my office, the natural trend is bending forward, bending forward. Okay, so Vajrasana is a system whereby we are giving a support to our um, rectum area, so that it is uplifted and we sit straight, and the energy in the backbone flows smoothly. So this is mental condition. You have to find, you have to understand and stay aware that this is happening and what is your role as far as your mind is concerned. But second thing is, some physical exercises we must do. Regular pranayam is very much helpful. Apane juhati prano prana apano tatha pare प्राणापान गतिरुद्ध्वा प्राणायाम परायण अपरे नियताहार प्राणेन प्राणेषु जुह्यति सर्व अप्येते यज्ञ विद्यो यज्ञ खेपेत कर्मसः. ये श्लोका 429 430, ये जो श्लोक दिया हुआ है, प्राणायाम को हर चीज, शरीर का हर चीज का समाधान के लिए बताया है. आपको डाइजेशन से लेके, कॉन्स्टिपेशन से लेके, बोन का प्रॉब्लम लेके, ओके, मेंटल प्रॉब्लम लेके, नी जॉइंट्स, कमर जॉइंट्स, वो सब चीज के लिए दिस इज हेल्पफुल. दिस प्राणायाम इज हेल्पफुल. और प्राणायाम में बोला गया कि युक्त युक्तम तेजो वायु युक्त युक्त च पुरोहिते युक्ताभ्यास योगेन Badhyadham siddhim papniyat. Means you have to practice pranayam with hold only. Pranayam, when you are speaking, it is with hold only. Okay, so now we see what are the exercises. Mind, the role of mind we analyzed. Now we have to see what is the exercises we can do. Okay, for these points. Again I am telling 4 points. First point is this point. We have to get aware. Second is this point. Third one is this point. And fourth one is hip joints. Okay. For first one I have given this exercise. स्पॉन्डलाइट्स के लिए जो करते हैं हम लोग. So this point you get a little bit of sensation, you feel comfortable, and there are other exercises like head rotation. Tongues reversed, always remember, because you have what is given, नच जरा नच क्षुधा दृष्टान्तस्य नच जरा व्याधि भय नच मृत्यु भय तस्य जो बेढ़ी मुद्रा खेचरीम नच क्षुधा दृष्टान्तस्य मीन्स भूख नहीं मतलब आपको एक्सेसिवली बॉडी में ऐसे सिचुएशन नहीं होगा कि यू आर वेरी मच हंग्री. Without hunger you cannot, without food you cannot manage for some time, not like that, food or water. न च क्षुधा दृष्टान्तस्य न च जरा व्याधि भय. जरा व्याधि, जरा means weakness, व्याधि means disease. न च मृत्यु भय तस्य जोबेड़ी मुद्रा खेचरी. Even death like situations you can manage if you are regularly practicing Khechiri mudra. So always while doing all these things you follow this Apana Vayu mudra, Mulbandh laga rehna और Khechiri mudra और mind on breathing. Okay. So we do head rotation. Again I will do that posture. The thing is that if you don't do, slowly these points will gather fat and you will find it difficult to make these points flexible. Okay. Second point. So this is the first point we discussed. Okay, there are other many postures for this also, but it's not possible to give all the things in one video. So because we are discussing 4 points. So next one is a slightly downward point, this point. Okay, this area. So here the variation of downward dog pose. Downward dog pose. This is okay. And another variation of downward dog pose. इवन उसका भी वेरिएशन जैसे भी so breathing should be normal during these things. So these are to be done. Even the thing is that I am not doing downward dog pose properly because this point of mine, this back flexibility of mine is not proper. It is not 100% correct because of this flexibility. Because overage, you cannot make it flexible. If at the childhood you will learn this, you will be properly be able or learn properly how to bend your back correctly. Okay, now at our level, um, we are doing our best, but it is not 100% accurate. Okay, we are simply practicing it. I am not getting the curve. You see many, if you see other videos, you will see the back curve is there with many people, but back curve is not there in my postures because that is not that much flexible and that is not that much lengthening one. Because in the course of time I never practiced it in my childhood or the beginning, the growth stage of my bones. So the curve I am not able to get the curves. This posture requires yoga wheel or yoga blocks so that your hand and your chin can be placed on that and you will try to make a curve. Okay. Now the third thing is our this back muscles, back, this one, this portion. Okay, this portion also we are not getting right curve. In two postures we are usually following, that is chakrasana and ustrasana and Kandapida sorry, Setubandha asana we are telling, bridge pose we are telling. So these are some of the postures we are doing. You see here also we are unable to get the right kind of curve required for smooth flow of energy. Things are half done, okay, because it is not possible in the grown up age, it's not possible to create curve, okay. It has to be done at the beginning of your growth period. Thereafter comes chakrasana. Om, 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 Om. Om, 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 Om. Om, 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 Om. So, 3 points you have covered. The fourth point is hip joint flexibility. Because hip joint is having most of the energy channels passing through. Sciatic pain, knee pain, okay, back pain, okay, the health of kidneys, okay, health of pancreas, most of the things depend the health of these muscles, okay. Because you see, when you are doing this, then kidney is getting exercise, pancreas getting exercise, the nerves going through these left and right side, they get exercise. exercised. So this is butterfly is one of the good uh, exercise for hip joint. Tongues reversed, मूलबंध लगा रहता है माइंड और ब्रीदिंग. Om, 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 Om. Hip joints other exercises are after doing the activation of these 4 points, you should do Mahabandh. Okay, Utthita Padmasana, because the feeling of the energies becomes symmetrical, synchronized in your body. Okay, so means total total distribution of energy system in your body becomes more facilitating by doing these postures after these activation of these things. You can see for yourself, because these are the supporting postures. Okay. So if you follow these postures regularly, definitely your backbone system will be strong. Okay, because Utthita Padmasana, after doing the exercise, you just relaxing them. Okay, and महाबंध जो कि बद्ध पद्मासन का ब्रीदिंग एनालिसिस, ब्रीदिंग पोस्चर है, तो उसी में भी आपका एनर्जी सिस्टम मिक्स हो जाता है, हर जगह पर इक्वली डिस्ट्रीब्यूट होता है. नाउ वी डू शीर्षासन. Okay, because after doing these postures, शीर्षासन is directly involved in the activating your bone system, skeletal system. Now we will do some breathing exercises. We will complete this. Thank you for watching my video.